it doesn't really necessarily matter what you're for. It's what can you get done.
Today, meet the candidate. Pennsylvania State Senator Jake Corman makes his case for the Commonwealth's top job. From buying now and paying later to staying out of debt this holiday shopping season, today we look at simple ways to keep your budget on balance. Also today, a new movement aims to make first aid for your mental health as common as CPR, how the program is already having an impact.
NBC10 at Issue starts now.
Good morning. Welcome to NBC10 at Issue. We're glad you're here. I'm Tracy Davidson. Today, Pennsylvania State Senator Jake Corman makes his case for becoming Pennsylvania's next governor. He joins an already crowded field of GOP candidates determined to snag the nomination. Corman has little name recognition in our area, even though he is the highest-ranking Republican in the Pennsylvania Senate. Corman's been a state senator since the late 90s. He represents a large section of the northern part of the state, which includes State College. He was originally scheduled to announce his candidacy on November 11th. That got delayed because he was diagnosed with COVID-19. Corman says he is fully vaccinated and that his symptoms were mild. NBC10's Mayk recently sat down with State Senator Corman for the first interview of his campaign.
You're getting in this race at a time when there are already quite a few Republicans running for governor. Why are you a better choice for voters than they are?
I think I differentiate myself by my accomplishments. It doesn't really necessarily matter what you're for. It's what can you get done. I've had a career in public service. I have a career of accomplishments, getting things done for the people of Pennsylvania, people in my district. And I think that differentiates me from everybody else in the field, that I can get things done, because that's what really matters at the end of the day. That's what we're judged by.
Is there something specific that you want to get done?
There's a lot of things I want to get done. First of all, I want to restore people's freedoms. I think over the last 18 months, we've had an infringement upon our freedoms through the pandemic and some of the actions taken by state government. I want to empower people to get the best education they possibly can. I want to make sure they have opportunities in the workforce, that they, the cornerstone of every good, healthy community is a good family-sustaining job, that they can support their families, support their community. We
are going to talk about some of the decisions that you would have to make as governor, possibly some of the remnants of the pandemic and decisions you would have to make as governor. First, though, I do want to talk about that not the 2022 race, but the 2020 race, because you have been involved in setting up an investigation to that 2020 election. This summer, President Trump called you out by name and asked, why is Jake Corman of Pennsylvania fighting so hard that there not be a forensic audit of the 2020 presidential election scam? Did you cave to what former President Trump wanted?
No, look. Governing takes time. It's methodical. You got to do things correctly. We obviously had concerns in the Senate Republican caucus about the 2020 election. Our constituents, there's nothing that I've heard more from my constituents on the street than the issues dealing around the 2020 election. I mean, geez, just this year, excuse me, our governor voted illegally in Pennsylvania, which is rather amazing when you think about it. So
you're talking about having his wife drop off a ballot.
So it's important that we make sure that people have faith in election results. The cornerstone to any democracy is that you can produce change at the ballot box. Because if you don't have the feeling you can go to the ballot box and produce change, then people act out in different ways that are not nearly as productive. So we have to make sure that people have faith. Sometimes Republicans win, sometimes Democrats win.
In this case, in terms of the 2020 election, you acknowledge Joe Biden won that election.
Joe Biden won the election. He's been certified as the winner. But clearly we have issues. And so what we need to do in a responsible way is put an investigation together to make sure that people have faith in the results. And so sometimes that takes a little bit longer than what people like, and they get a little frustrated. But you have to do an investigation that has credibility. That whether you're Republican, whether you're a Democrat, whether you're independent, you believe in the results. Because if you just do a one-side, like if we're Republicans and George Soros was funding an investigation, would we have faith in that? No, obviously not. So
Republicans are running this investigation.
Correct, but we're going to do it in a way that I think people will have faith.
Are you looking for something specific, or is this just a show to satisfy people?
Look, anytime you enter into something like this, you don't predetermine your results. You take where the evidence, you go where the evidence takes you. So we don't have a predetermined result. We passed a bill trying to deal with election security. The governor vetoed it. But we still think there's more that we can do. We just don't want to ignore it and move on.
Part of that investigation is to get some personal information of voters, which includes driver's license number, part of Social Security number. How will that information be safeguarded?
The Department of State has done this to independent contractors numerous times. The League of Women Voters, when they sued back in 2012 to stop the voter ID law that was passed under Governor Corbett, got access to the same information. We'll do all the Department of State they do for their vendors, sign whatever confidentiality laws that has, punishment, if they do leak it out. So we'll do whatever the Department of State normally does when they allow other independent contractors to come in and look at this information.
In terms of schools, you have been opposed to a mask mandate for schools. So what would your plan be then to make sure kids are safe?
The governor asked the school districts to go out and set up a safety plan. My children go to public schools. I have 2 boys in a public school, a daughter in college. And the school put a safety plan together. They worked very hard during the summer, held lots of public meetings, and they developed safety plans. As a parent, I followed that, reviewed it, and was comfortable that they were doing the right things. I was comfortable allowing my child to go to school. The governor came in and circumvented it all. He said, well, you didn't do what I wanted you to do, and so therefore I'm going to just mandate this. It's important to understand they don't have the authority through the Secretary of Health to do this. And that's a big issue. They got to go through the legislature to do something like that. Got to go through a regulatory process to accomplish something like that. I'm going to empower.
That's under a question in court right now.
I'm going to empower people. I'm going to empower our local communities to make decisions. I think that's where these decisions should have been made. The governor made a terrible mistake last summer when he shut down the hospitals from all their elective care. I said to him at the time, Governor, these are medical experts. They're in the medical field. They understand, how to handle this. If there is a surge, they'll be able to deal with it. The governor said no. Secretary Levine at the time said no, and they shut him down. And so a lot of people didn't have access to health care because he didn't trust our health care system to be able to handle this. Found out that we didn't get the surge in that summer. In the fall, we did get a surge. He didn't shut them down, and they were able to handle it. So I'm a big believer that you get information out, you get people the best practices, the guidelines, and so forth, and let individuals make the best decisions for themselves.
Let's go from schools then to businesses. And there's been a lot of discussion about vaccine mandates and where those should come from, or if they should come from anywhere. What is your feeling on private businesses and their right to set vaccine mandates for their own employees? Do you think that businesses should have the right to make those decisions, or would you be opposed to that?
I don't like infringing on private business. I think private business should be allowed to determine what they need to do to keep their employees safe and keep their environment safe for people to work and people to come and whether it be a restaurant type of business or a private business, the public comes in and interacts. So I think those businesses, again, we should empower them to make decisions what's in the best interest of their business, of their employees, and make the health and safety concerns that they see are fitting.
I want to touch about a couple other issues that could come to you if you are elected. The minimum wage. You said back in 2019 that the minimum wage discussion needs to happen. Fast forward, here we are in 2021. The minimum wage is still $7.25 in Pennsylvania. If you're elected governor, what would you do regarding the minimum wage, and where do you think it should be?
Well, we did pass a minimum wage in the Senate. Unfortunately, it increased. I worked with Senator Tartaglione from Philadelphia to make that happen. She's been a strong advocate of minimum wage increase for years. And we passed it in the Senate. Unfortunately, it did not get through the House. Obviously, now minimum wage is not really a relevant point because the wages are so much higher. You just go around and look at any convenience store, any restaurant, they're all offering far higher wages than what the minimum wage is. So I still think it's something that we should raise at some point.
Where do you think it should be right now?
Look, I think we negotiated a small increase up to nine something. I can't remember the exact number, but it's a delicate thing. I think it's something you got to transition into. I know, the governor's proposal to go right to $15. I think would have been a mistake. I think it would have cost jobs in Pennsylvania.
If you or one of your other Republican colleagues or opponents were to be elected, there's a possibility, a good possibility, that Republicans would basically control everything in Harrisburg. And things could look different. Things that maybe did not get through under Governor Wolf may get through in a Corman administration or an administration of one of the other Republican candidates. That, of course, has some Democrats concerned about specific issues. One of the hot button ones would be abortion. What would you support as governor? Would you support the kind of abortion law that we've seen in Texas?
Pennsylvania has a very strong Abortion Control Act, which I support. We've tried to update it over the years. So, I will continue to be a pro-life governor. But as far as hypotheticals, let's just wait and see. The courts haven't given us that opportunity as of yet. When they make that decision, we'll react to it at that point.
Other Republicans seeking the nomination include former U.S. Attorney Bill McSwain, political strategist Charlie Giroux, Montgomery County Commissioner Joe Gale, former U.S. Representative Lou Barletta, the former head of the Chester County Chamber of Commerce, Guy Shiraki. Right now, Pennsylvania Attorney General Josh Shapiro is the only Democrat seeking the nomination from his party. The list of Republicans seeking the gubernatorial nomination could grow even larger. GOP party officials say the last time there were this many candidates was 1978. Stay with NBC10 at Issue for your chance to meet more of the candidates. Next on NBC10 at Issue, it is tempting. Buy now, pay later. But you can end up owing a lot more than you expected. We'll tell you how to protect your hard-earned cash. Now to important new information from NBC10 Responds. As Black Friday closes in, many are buying on a budget and looking for ways to stretch their holiday shopping dollars. Buy now, pay later options could help you break up your payments. Are they convenient? Oh, definitely. Do they have pitfalls if you don't follow the rules to a T? Absolutely.
They provide instant gratification, right?
100% buy now, pay later gets you your gift instantly. And according to consumer counselors at Clarify, the offers are everywhere.
They have exploded. I mean, they've gone up 200% in year over year from beginning of 2020 to 2021.
The concept is easy. An item you want to buy costs $200. You can break it down into 4 easy payments. Put $50 down, then you make the remainder of the payments in 6 weeks or longer, depending on the terms. This is an installment loan. You'll pay late fees if you miss one of those payments. The average fee is $7 to $8.
They impact your credit. So if you don't pay, your credit is going to take a hit.
And buy now, pay later could cost you in interest. Remember, these are a loan. Zero interest loans are available, but many charge interest as high as 30% APR. So on a $200 item, you could potentially pay an additional $60 in late fees and interest if you don't pay on time. Now, if you want to buy now, pay later, make sure you understand the terms and conditions. Set up automatic payments or reminders so you won't be late. And know what the return refund policy is. Also, this holiday season, you can expect higher prices for just about everything. But you can avoid getting into holiday debt by keeping a few things in mind. According to creditcards.com, if you already have debt, avoid putting more purchases on that credit card. Instead, try to stick to cash and debit. If you're looking for a new credit card to help space out your holiday payments, shop around for 0% balance transfer card. Some lenders are offering up to 21 months with no interest. The senior industry analyst at creditcards.com explains it's not too late to sign up for a new card and squeeze in your holiday shopping.
We're seeing more and more cards giving instant approval and instant access where you can actually get that number right away and maybe load it into your mobile wallet or use it online. Even if they have to ship it to you, it should take probably a week or less.
Here's another good tip. Many credit cards are offering perks like big travel cashback sign-up bonuses, but they often require you to spend anywhere from a few hundred to a few $1,000s within the first few months. The holidays could be a good time to apply, especially if you plan on spending more this time of year. Your credit card may also offer additional discounts if used at certain big box retailers. Look for those promotional offers through your credit card's website or app. Maybe it could be an additional 5 through 20% off. And if you're thinking of buying a protection plan for a holiday gift, creditcards.com says that coverage may already be built into your card.
Things like extended warranty coverage, purchase protection, if something breaks or gets stolen, these are covered for free on a lot of credit cards. So these are some other things that I would think about as you do your holiday shopping.
You can find out what perks your credit card has by calling their customer service number or checking out details through your account. Remember, if you have a consumer problem that you just cannot get resolved no matter what you've tried, that is what we are here for. Give us a call at NBC10 Responds. Numbers are right there. We'll help you in English or Spanish. You can also go on our website, Fill out our complaint form. Give us all your documentation, NBC10.com/response, and we will get to work. Next on NBC10 at Issue, you may have a first aid kit like this in your home to help fix those minor bumps and bruises, but what about something similar for your mental health? We'll tell you how to make that happen. We're all familiar with first aid kits. You likely have one in your home right now. It's there for those minor emergencies that can happen, cuts, scrapes. But what if you could put together a first aid kit for your mental health, your mental wellness? What would that look like? The National Council for Mental Well-Being believes there are ways to give first aid to someone experiencing a mental health or substance use related crisis. And they train people to learn the risk factors and the warning signs and then give help, give strategies for helping. With me now is Tremaine Elamine. She's a client experience officer with the National Council for Mental Well-Being. Thank you so much for being here, Tremaine.
Thank you so much for having me, Tracy. I can't tell you how excited I am. I'm a Philly girl through and through and excited to be talking to you today.
So this is such a unique idea, but it makes so much sense when it comes to mental wellness. Tell me about the need.
The need is great. I mean, 1 in 5 of us in any given year meets the criteria for a diagnosable mental health condition. And because of the global pandemic, because of so many exacerbating environmental issues, including our attentiveness to our racial equity and so many things that are happening in our communities, the need for this is heightened. And we've seen that over time and over the last year, there's been such an impact in schools and especially in our workplaces.
And tell me about the training. What do you offer?
Absolutely. Mental health first aid is exactly what you talked about earlier, Tracy. It's this opportunity to really identify earlier what signs or symptoms might exist around mental health challenges or substance use challenges for individuals that are in our communities, in our families, and in our homes. We're excited to have had the opportunity since 2008 to bring this life-saving information through the National Council for Mental Well-Being to more than 2.5 million people across the country. And in Philadelphia specifically, they've led the pack as it relates to cities making a commitment to bring this to the community by training more than 26,000 individuals across the city in this one-day course.
I'm thinking that we made the remark like CPR. A lot of people are trained in CPR. Who should be taking this kind of course? Because I can think maybe I should take it so I would be helpful to my family, my friends, my coworkers.
Absolutely. Tracy, I think that there's such a need. If we think about CPR and first aid, it's required for work, right? It's something that we need to know how to do. And even if we aren't sure about what those steps are, what we know is if someone's choking, we know to give them the Heimlich maneuver. Similarly, for mental health first aid, we teach a 5-step mnemonic that helps people know what to do, what they see, and who to call for support. It also helps us to have those really tough conversations when we're thinking about mental health challenges or substance use challenges. Sometimes we shy away from them. So it's really about making that conversation comfortable. And what we know is from our evidence that it means that the more people who know how to help can help people get connected sooner and decrease the time that someone is really struggling with their well-being.
I'm not going to ask you to condense the curriculum into 2 minutes, but give me an idea about the kinds of things that somebody would learn to identify and then jump in and have perhaps the uncomfortable conversation to try to help someone.
Absolutely. The thing that I think is really critical when it comes to mental health first aid is often we think it's okay to say something like, everything's going to be fine. And we think that that's reassuring. And so what we teach is to assess for what are the risks, suicide or any harm that might come to a person. We teach how to listen non-judgmentally and give reassuring information, and also, we tell people how to help, whether that's encouraging professional help or other support strategies that might be in their community, like speaking with a family member or a faith leader. We teach people that it's okay to not be okay and give them the tools and skills-based information on how to support someone in connecting the dots, whether that's at home or even at work.
Tell me about the cost.
So in a lot of communities, similar to Philadelphia, there is support for this program at the ground level. That's who's doing the real work. We have a network of more than 20,000 instructors nationally who are in organizations nationwide providing this training to the community at no cost. Then there's also places where there is a cost. It's a nominal fee for the manual itself. And people, if they're interested, can become instructors of the training as well. What we know is that across the country, the city of Philadelphia has contributed to the state itself being number 5 in the most people trained across the country for mental health first aid. And so what we know also is that being able to access this information can be in your backyard. Whether you're in Philadelphia, you can go to the Department of Behavioral Health's website, healthymindsphilly.org, to sign up. Or if you want more information, you can go to mentalhealthfirstaid.org to get more information and find a course near you.
Tremaine El-Amin, Client Experience Officer with the National Council for Mental Wellbeing. Tremaine, thank you so much for being with us today.
Thank you, Tracy.
This is NBC10 at Issue.
Time is running out, and we don't want you to miss out. Seniors, if you have a produce voucher from the Department of Agriculture, you have to use it soon because they expire on Tuesday, November 30th. They're part of the Senior Farmers Market Nutrition Program. They can be used at a lot of local farmers markets, but officials fear that some people are saving their vouchers for the holidays, and they warn the farmers markets in our area are beginning to close for the season. Bottom line, use it now. That does it for this edition of NBC10 at Issue. I'm Tracy Davidson. Thanks so much for joining us. Please join me again tomorrow, beginning on NBC10 News at 4. Have a great day.